Don't forget to know the cervical enlargements, the lumbar enlargement. There are cervical spinal nerves, the number of 8 cervical spinal nerves, the conus medullaris. The spinal cord stops at L1 and L2, and also between the end of the spinal cord and the end of the spinal canal, you have what's called the cauda equina, right here, horse's tail. Over to the side, this is what the gray area looks like, and the white area. We're going to get into that here in a minute. If I can get this to work. This is a simplistic picture of a spinal cord cross section. Also remember that the spinal nerve is both sensory and motor, which is afferent and efferent. It's called a mixed nerve here. On the spinal cord cross section, you have white matter and gray matter. We're going to get into details on this in a minute. You have the central canal, posterior median sulcus, which is to the back, anterior median fissure, dorsal root to the back with the dorsal root ganglion. And remember, the ganglion is a mass of cell bodies in the peripheral nervous system, all the way down to the ventral root. In the next few slides, I will go over this area right here. Here in class, we went over the spinal meningeal layers, the dura, the arachnoid, and the pia. And the space above the dura is the epidural space. Below the dura, subdural space. Below the subarachnoid mater is the subarachnoid space. This is filled with cerebrospinal fluid. Below the arachnoid mater is the pia mater. This is the delicate mother. And supporting the spinal cord from side to side movement is the denticulate ligaments. This is a picture of the spinal cord. Right here, the very delicate mater is the pia mater. To the sides, you can see the arachnoid mater. These are spinal nerve roots, the ventral root of the spinal cord. So this is looking at the spinal cord from front to back. Over here is the dura mater reflected. And as you can see here, this is in the cervical spine, ventral root of the 6th cervical nerve. Here you can see the dura, looks like a leather jacket. The arachnoid looks kind of like a wool sweater. And the pia mater, which is a very thin layer of dura of mater, right over top of the cord. You can also see the dorsal root ganglion right here. Over here, dorsal root ganglion. This is the dorsal root right in through here. And the ventral root. White matter carries information from place to place, contains myelination. Gray matter, region of integration and command initiation into functional groups of sensory and motor nuclei. I'm going to go to the picture which will describe the gray horns or the butterfly shape better. On this drawing or this picture I want you to know pretty much everything. The white columns, there's a posterior white column, that's the white area, a lateral white column, and an anterior white column. Same thing with the horns. You've got an anterior horn area, lateral horn, and a posterior horn. Make sure you know all 6 of these. In the back, posterior median sulcus, anterior median fissure. On the back over here, you've got the dorsal root ganglion, and this would be the ventral root. This talks about the somatic and visceral sensory coming in through the posterior root and then going out as motor from the ventral root. So remember, motor is on the ventral root, sensory coming in on the dorsal root, which is sensory coming in is afferent and motor going out is efferent, like we've talked about before. This is a cross-section micrograph of a spinal cord section. And you can see here the gray horns look like an upside down butterfly. Look at that. Upside down butterfly. This would be the white columns in through here. Dorsal root ganglion, anterior root as well. This talks briefly about tracts or fasciculi, bundles of axons in the central nervous system that are relatively uniform in diameter, myelination, and conduction speed. So they relay the same type of information, whether it's sensory or motor, in the same direction. Short tracts carry information between the segments of the spinal cord. Longer tracts connect the cord to the brain. Ascending tracts carry information to the brain from the body, so they're ascending to the brain. When it's from the brain down to the body, that would be descending tract, and that would be motor commands. That would also be efferent. So the ascending starts with an A. It is afferent. Descending has an E in it. It is efferent. D-E, it's descending. Efferent. Think of it that way. The point I want you to get out of this slide is the spinal cord is highly organized, so it is possible to predict results of injuries to very specific areas of the cord. Basically, if a person comes in with a certain set of symptoms and signs, you can virtually tell what part of the cord has been injured or what part of the cord has inflammation according to the sign and the symptom that the patient is exhibiting. So keep that in mind. I am skipping over some of the slides to give you an in-depth. Every spinal cord segment is connected to a pair of spinal nerves, one on the right and one on the left. Now remember, the spinal nerves are the dorsal and the ventral nerve roots come together to create a mixed nerve. These nerves are surrounded by 3 connective tissue layers that support each spinal nerve. These 3 connective tissue layers, just like in the muscle, epi, para, endo, and the last part, neurium. So epineurium, outer layer, paraneurium, middle layer, endoneurium, the inner layer, surrounds individual axons. So it is not dura arachnoid pia that surrounds a spinal nerve. It is epineurium, paraneurium, endoneurium. Looking at this figure, on the outside, epi, para, around a bunch, and then endo around the axon itself. Nerves interconnect, branching, and eventually form what are called plexuses. There's another picture of the epiparaendo. Plexuses and spinal nerves. The spinal nerve forms just lateral to the IVF or the intervertebral foramina. Looks like this. You've got the dorsal root with the ventral root coming together to form a mixed nerve called the spinal nerve, right about at the IVF. Motor nerves. This talks about motor nerves, carries visceral motor fibers of sympathetic ganglion to autonomic nervous system. So coming in through the dorsal root would be afferent. That would be feeling, right? Sensory. Going out, now we're going to talk about the sensory nerves in your skin, bilateral areas of the skin, monitored by a single pair of spinal nerves. Each pair has its own dermatome, just like in the country, each part of the country has its own state. Damage to a spinal nerve or dorsal root ganglion will produce loss in the corresponding region of the skin. So these are sensory areas of your skin that are supplied very specifically by bilateral regions. A single pair of spinal nerve will go on right and left, and it looks like this. Now I don't want you to memorize this, I just want you to have a good idea of what it is. This is something that you could probably take, cut, put into a little card and laminate it and carry it around for reference. And there are a lot of different references to this. There's a lot of different views, but this is the different regions of your skin. Mostly the upper, the arm, and the leg are the ones that most nursing students need to know. So you'd have 5, C5, C6, C7, C8 going down around here, and T1. T1 and T2. And the leg, they go at a different angle. So we're going to look at nerve plexuses. This is the blended fibers of the ventral rami, controlling skeletal muscles. So this is the ventral. You have cervical, brachial, lumbar, and sacral. There's an overall picture of the cervical up above, brachial into the arm, lumbar and sacral in the lower part of the spine. And just remember that in the cervical plexus and the brachial plexus, you have what's called a phrenic nerve, and that actually controls the diaphragm. Know these major nerves of the brachial plexus. Now, it's actually easier than you think. You've got the ulnar, which is, remember the ulna, the bone. The radial is another bone. Axillary stands for the arm. Median is in the middle. That's the one that you have a problem with when you have carpal tunnel. And then the big word musculocutaneous. So know these major branches. It could be a test question like a multiple choice. Look at it as it comes through the thoracic outlet region. That's where somebody has numbness with their arm. It could be a thoracic outlet up here. And on this slide, I want you to know the trunks and the cords. And we will get to this on the next PowerPoint.